With the busy Mother's Day weekend ahead, health officials are warning the pandemic is not over. The Biden administration now predicting as many as 100 million newly infected Americans with COVID-19 in a fall and winter surge, up to 30% of the U.S. population. This comes as the White House is urging Congress to pass more than $22 billion in COVID relief funding, saying a lot is at stake if lawmakers remain gridlocked.
The consequences here are quite catastrophic if we do not get funding. I mean, my goodness, we're not going to have vaccines for the American people. We're going to run out of treatments for the American people. We're not going to have diagnostic testing.
Officials are also bracing for a COVID comeback this summer. At least 37 states are already seeing an increase in hospital admissions. We caught up with Nick Morey with Sacramento County Public Health for a look at local conditions.
Yeah, we've seen an uptick in case rates locally over about the last month here, which mirrors what we're seeing throughout the state of California right now.
Officials blame COVID-19 subvariants and the relaxation of COVID restrictions like masking for the increase in cases.
But thus far, we have not seen a corresponding uptick in hospitalizations, which is certainly a good sign so far.
More Americans are turning to the drug Paxlovid to fight COVID, with its use up tenfold in recent weeks. But scientists are now investigating some reports of a relapse in COVID symptoms in about 2% of cases. For example, after taking the 5-day course, 63-year-old Lauren Martin tested negative and started to feel better. But a week later, her symptoms reappeared.
My symptoms second time around, especially just right from that first day, were stronger than my symptoms the first time around.
In clinical trials, Paxlovid cut the risk of hospitalization by nearly 90%. And despite some reports of relapse, many health experts say they are still confident in the drug's benefits.